Types of brain disorders: Alzheimer's disease, dementias, brain cancer, epilepsy, and other seizure disorders, mental disorders, Parkinson's and other movement disorders, stroke, and transient ischemic attack, TIA. Alzheimer's disease is a brain disorder that gets worse over time. It's characterized by changes in the brain that lead to deposits of certain proteins. Alzheimer's disease causes the brain to shrink and brain cells to eventually die. Alzheimer's disease is the most common cause of dementia, a gradual decline in memory, thinking, behavior, and social skills. These changes affect a person's ability to function. Dementia is a syndrome that can be caused by a number of diseases which over time destroy nervous cells and damage the brain, typically leading to deterioration in cognitive function, i.e., the ability to process thought beyond what might be expected from the usual consequences of biological aging. While consciousness is not affected, the impairment in cognitive function is commonly accompanied and occasionally preceded by changes in mood, emotional control, behavior, or motivation. Things that increase the risk of developing dementia include age, more common in those 65 or older, high blood pressure, hypertension, high blood sugar, diabetes, being overweight or obese, smoking, drinking, too much alcohol, being physically inactive, being socially isolated, depression. A brain tumor is a growth of cells in the brain or near it. Brain tumors can happen in the brain tissue. Brain tumors also can happen near the brain tissue. Nearby locations include nerves, the pituitary gland, the pineal gland, and the membranes that cover the surface of the brain. Epilepsy is a disorder of the brain characterized by repeated seizures. A seizure is usually defined as a sudden alteration of behavior due to a temporary change in the electrical functioning of the brain. Parkinson's is a neurological condition which affects the brain's ability to produce dopamine, the chemical which helps us control movement. The condition is life-altering but not life-threatening, while some advanced symptoms may make you more vulnerable to infection. For most people, Parkinson's will not significantly reduce life expectancy. The two main groups of symptoms are motor symptoms, affecting movement, such as tremor, shaking, muscle rigidity, and slowness of movement, and non-motor symptoms like pain, anxiety, and depression.